Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello and welcome to today's episode of Podcast. My name's Sarah Jarvis and I'm here today from Wesleyan Bank. I'm going to talk to you a little bit about top things to consider when deciding who to sell your dental practice to. So in my job, I'm speaking to dentists who are looking to sell their practice, and they say, I'm looking to sell my practice in the next 1, 2, 3, 4, 5 years. What do I need to do to prepare? What do I need to consider? And the first thing I always say is you need to prepare your timetable. In an ideal world, I would say that you need to start preparing 3 to 5 years before you look to sell your practice. And I know things don't always go to plan, and you might not always be able to plan that far in advance, but you should generally have a rough idea of when you think you're likely to want to sell or move on from the practice. But still, people are always really, really shocked. For 3 to 5 years, that's a really long time. Why do I need to plan that far in advance? The main reason, I'd say, is to get your financial accounts in order, which is what anybody who's going to buy your practice is going to look at. And the reason it takes so long to get your financial accounts in order is that any improvements that you make to your business will take 18 months, or up to 18 months, to show on the financial accounts. And for the bank to consider it, because if you have to think about it from the bank's perspective, for the bank to consider it a stable business or a stable improvement, we need to see that for 2 to 3 years. So that's really where the 3 to 5 years comes from straight away. But you need to think about, is your business cost effective? Are you making the most of what you've got? Is there any way that you can easily increase turnover? Because realistically, any increase in turnover is going to increase the bottom line, which will increase the value of your practice. Second reason, I'd say, is to get your practice to look in top shape. Don't be afraid to spend money to make money. And the reason I say that is that a modern practice that's computerised with working equipment doesn't need to be high-end, top-of-the-market equipment, but have nice working practice is much more desirable than somebody who's got a dated practice that's still got paper files. Although paper files are still fine, but the reason is it's like buying a house. If you go and view a house and it's all a bit dated, you have to really imagine and think about what it could look like with you in it. So if you have a nice practice that everything's okay, yeah, you might want to envision changes, but you can see that what you're going to do and how it's going to work and how it's going to fit with you. Also, if you're selling to somebody who's maybe a first-time buyer or somebody who might be putting a lot of their cash capital into it, the funding options that are available to you might not be available to them. And that's, as an established dentist with an established practice, it's much easier for you to either, obviously you might have some cash reserves, or to go to a finance provider and get that funding to invest in the business. Other things that you just need to consider that could affect people borrowing money are things like the lease. Can it be renewed? Is it long enough? Because most banks will only lend for the term of the lease. And CQC, have you made any improvements that CQC asks you to make? The next most important thing to consider is, what is my practice actually worth? And being the bank, I see all sorts of things and all sorts of valuations. You'll see my friend Bob, who sold his practice for £2 million and it's £500,000 turnover, or you'll see the dentist that's retiring and he's had a direct offer of £500,000 for his £1 million NHS contract. I know they're both quite extreme examples, but I think you just need to be realistic as to what your practice is actually worth. You might ask, well, how do I know? I'm not a valuer. I don't know what my practice is going to be worth. And I think that if you ask that question, it highlights the importance of having the right team around you. So speak to dental agents. They have a wealth of knowledge and they know exactly what's going on in the market. Speak to your dental accountant. Hopefully you've got a specific dental accountant and they can assist you with what their other clients are getting in the market. Or speak to your dental solicitor. Most dental solicitors will have been through practice acquisitions recently and they can give you an idea of what practices are selling for. Also, in the early stages, like hopefully if you're in your 3 to 5 year plan and you're just trying to work out what your practice is worth, there's lots of information online. So NASDAQ release statistics, and also a lot of the sales agents will also release figures of what practices have sold for recently for you to reference. Without all these tools, it can be quite difficult to actually work out what the value of your practice is, and that's because years ago it just used to be a multiple of turnover, whereas now there is so many more variables to how you actually attribute a value to a practice. One of the things that they will look at is income split. So that could be something from like fee per item income. Obviously that income is generally kind of a one-off driven income. NHS income, obviously as long as you're meeting the NHS contract, then that is a guaranteed income monthly, so that could hold a higher value. Also, do you have any plans in place? So obviously the plans can be almost guaranteed income because subject to you meeting the criteria of the patients. And other things, like I just mentioned before, things like the lease, the term of the lease, that can affect the value, and competition. Is there any new competition in the area? And it basically boils down to those factors and a multiple of EBITDA. Also as well, although it doesn't attribute to the goodwill value of your practice, fixtures and fittings. Now, I have seen practices that need some updates that have been marked down quite significantly for the value of the fixtures and fittings, and also practices that are modern with lots of equipment, they've been marked up quite substantially for the value of their practices. So now the killer question: you've done all the prep, you've done all your research, who are you going to sell to? Really, there's no right or wrong answer. I can't give you a magic answer, but I can give you some pros and cons of who you can sell to. I would break it down into 3 main categories of buyers. So the first one is your associate. So if you've got an associate at the practice that you've been working with for a few years, that's obviously a potential buyer. A corporate. Or if you don't have those options, or you still want to look around, an introduced buyer. So that's somebody that could be introduced via a sales agent. So let's look at the associate first. So if you've been planning for the last 3 to 5 years and you've got a great associate at the practice and they're eager to buy, and that's brilliant if you've been working towards that goal. And that's great if you've got that relationship already, because you already know them well, and if you're planning to stay on, then you know that you can work well together, the patients know them, and you can trust that they will look after your practice. Because for many people, selling a practice can be quite an emotional time as well, because you've put a lot of your blood, sweat and tears over the years into this practice, you've built it up, or you've invested a lot of time, you might have even opened it up from scratch. So there is a real emotional thing, and handing it over to somebody that you trust can be a real positive. But there are some things to consider when selling to an associate. Actually, the process of buying and selling a practice can be stressful. To be honest, it can be quite stressful. I go through them regularly, they are quite stressful. And that is if you've got an absolutely amazing specialist team with you. So that's something to consider. But it could put a little bit of strain on your relationship, so that's something you need to make sure. Is the associate in the right place financially? So the associate might be really keen and want to buy, but they have to consider that most people will need to get finance for buying a practice. And a lot of the high street lenders have a one-size-fits-all approach, so they need to make sure that they are talking with a specialist lender. The next category, corporate. No, that's not a dirty word. Selling to a corporate is a perfectly reasonable solution. Some people consider it as an easy way because they've got funding available, there's lots of positives there, but it's not without its challenges. So you're right, they do have their funding available, so you don't necessarily have to wait for them to go through the funding process, and they will normally offer you a good price. But quite often you will have to stay on as an employee as part of that sale. So it's a bit of a shift in going from running your own practice to becoming an employee and having to work for a corporate. You might have targets, you won't be able to do things the way that you used to do. And it can sometimes be a little bit of an adjustment to not have control. Also as well, there is normally a part of the purchase price linked to that, those targets, so that's a deferred payment for you, so it's an incentive for you to stay on longer. And last but not least, the introduced buyer. Now, this it's not necessarily a negative thing. You might not have an associate, you might not want to sell to a corporate, and you might just want to see who's in the market and what sort of buyers are available to you. Dental agents have hundreds of prospective buyers, so don't ever worry about who's going to buy my practice, because there will always be the right buyer out there for you. So the advantages of having somebody that's introduced to you, quite often they will have already spoken with a bank about funding. So I speak to a lot of people that are looking at buying practices, and they're looking at putting offers in, and they want to know how much they can borrow. So quite often they would have already been at that stage and had that level of conversation, and they'll probably be in a position to buy. Even though they are really a complete stranger, you can meet with them, you can spend time with them, you can go for coffees with them, because if you want to stay on, then it's important that you get on with that person. And also, if you don't want to stay on, then you want to make sure that your business is going to be looked after you've left. But on the flip side, you are still selling to a stranger, so it is a case of you having somebody that you don't know or haven't got a relationship coming in and taking over your business. You have to show quite a few people around your practice, which can be quite time consuming and answer lots and lots and lots of questions. That's fine if you're happy to do that, but it can be quite a drawn out process, because they don't know a lot about your business, and if they're going to be spending lots of money, then they want to make sure that they get the right information in advance. So overall, who to sell your practice to? Well, really it's your decision. Each buyer has its own pros and cons, but it just needs to be what works with you. And the most important things are to prepare, not just the practice and the accounts, but yourself, because it can be quite a long process, can be quite a stressful process, and you need to make sure that you're in the right place for that. Get the right team around you. If you've got the right team, so if you've got a sales agent that's going to help you, if you've got the right solicitors that understand the dental sector, if you've got a good accountant, then it will be a much easier process for you. But most of all, understand the value of your business. Don't be flattered, and don't just take the first offer that you get, but make sure that you are not afraid to get what your business is worth. Thank you very much.